Omega-3 fatty acids are believed to reduce the risk of heart disease and can be used to lower triglyceride levels and raise HDL cholesterol when combined with diet and exercise. Some supplement products may contain harmful impurities or additives, so it's important to check with your pharmacist about the brand you use. The U.S. Food and Drug Administration has not reviewed Ocean Blue Prenatal DHA for safety or effectiveness, so it's best to consult your doctor or pharmacist for more details. It is recommended to take one soft gel daily with a meal for optimal absorption. When taking Ocean Blue Prenatal DHA, be sure to follow the directions on the package label. If you have any questions, consult your doctor or pharmacist for guidance. For the enteric-coated capsules, swallow them whole. If you're using the chewable form, make sure to chew thoroughly before swallowing. And if you're taking the liquid form, use a special measuring device to ensure the correct dose. It's important to shake some brands of this medication well before each use. If your condition persists or worsens, or if you suspect a serious medical issue, seek medical help immediately. Some possible side effects of Ocean Blue Prenatal DHA may include a fishy aftertaste, if the product is made from fish oil, nausea, bloating, or burping. If any of these effects persist or worsen, it is important to notify your doctor or pharmacist. If your doctor has recommended this product, it is because they have determined that the benefits outweigh the risks of potential side effects. Most people using this medication do not experience serious side effects. However, it is important to seek immediate medical attention if you experience any serious side effects, such as easy bleeding or bruising. While rare, a very serious allergic reaction to this drug may occur. If you notice symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing, seek medical help right away. It's important to note that this is not a complete list of possible side effects, and any other effects should be reported to your doctor or pharmacist. If you have concerns about side effects, you can also contact your healthcare provider for medical advice. Before starting to take Ocean Blue Prenatal DHA, it's important to talk to your doctor or pharmacist if you have any allergies, especially to fish or peanuts/soy, as this product may contain inactive ingredients that can cause allergic reactions. If you are pregnant, it's important to use this medication only when clearly needed. Be sure to discuss the risks and benefits with your doctor. If you are breastfeeding, consult your doctor before taking this product, as it's unclear whether it passes into breast milk. The recommended daily dosage of Ocean Blue Prenatal DHA is typically one soft gel per day, preferably with a meal. It's best to take it at the same time every day to help you remember. Be sure to follow the instructions on the product label or as directed by your doctor. When taking Ocean Blue Prenatal DHA, it is important to be aware of potential drug interactions. This is because drug interactions may change how your medications work or increase your risk for serious side effects. It is recommended to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. It is important not to start, stop, or change the dosage of any medicines without your doctor's approval. It is always best to consult with your healthcare provider before making any changes to your medication regimen. If someone has taken too much Ocean Blue Prenatal DHA and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical attention. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center for assistance. Remember to stay on top of your medical appointments and tests while taking Ocean Blue Prenatal DHA. Your doctor may want to monitor things like cholesterol and liver function to make sure everything is on track. Make sure to consult your doctor for more information about this. If you forget to take Ocean Blue Prenatal DHA at your regular time, take it as soon as you remember. If it's close to the time of your next dose, just skip the missed dose and take the next one at your usual time. Do not take a double dose to make up for the missed one. Make sure to check the storage information on the package and ask your pharmacist if you have any questions. Keep the Ocean Blue Prenatal DHA away from light and moisture, and do not store it in the bathroom or freezer. Keep it out of reach of children and pets. Do not flush the medication down the toilet or pour it into a drain unless instructed to do so. When the product is expired or no longer needed, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.